Hi, today my group and I will be presenting a paper on polycystic ovary syndrome and its relation to microRNAs. Polycystic ovary syndrome, or PCOS, is a complex metabolic and endocrine disorder affecting at least 7% of women of reproductive age. Women diagnosed with the condition experience irregular menstruation, severe acne, hirsutism, obesity, and infertility. The condition can be morphological with multiple and predominant cysts on the ovaries or predominantly biochemical. Phenotypic characteristics of PCOS widely vary depending on individuals' life stage, genotype, ethnicity, and environmental factors. However, the three most common factors associated with the condition include ovulation irregularities, being infrequent or a complete absence of periods, and excessive bleeding during menstruation. Hyperandrogenism is linked to hirsutism, severe acne, and alopecia, and the primary factor being cystic ovaries, that is, enlarged ovaries with multiple painless cysts. These can be found on an ultrasound and are identified as polycystic if 8 or more cysts are present. Women with PCOS have higher rates of endometrial cancer, dyslipidemia, and type 2 diabetes. The etiology and pathogenesis of the condition is not definitively known. Along with this, no definitive tests exist to diagnose PCOS. Currently, an extensive medical history, physical exam, blood test to assess hormone levels, and a pelvic ultrasound is carried out to assess the possibility of PCOS and rule out other conditions. It is determined in part by genes, and while there is no single PCOS gene, women can inherit the risk. The genetic link associated with PCOS has prompted small studies to assess microRNAs in the diagnosis of PCOS. MicroRNAs are short, non-coding, single-stranded RNAs that are involved in the post-transcriptional regulation of gene expression and responsible for modulating numerous regulatory functions and biological pathways. They are relatively stable and can be detected easily by a quantitative reverse transcriptase polymerase chain reaction, or RT-PCR. Thus, microRNAs profiling serves as a potential non-invasive biomarker for disease diagnosis. In PCOS patients, studies have found that serum levels of various microRNAs are found to be different when compared to normal subjects. Altered microRNA levels have been associated with insulin sensitivity or resistance and inflammation, which are features of PCOS. The analysis of differentially expressed microRNAs in PCOS patients could therefore be useful not only as a biomarker but also in the disease prognosis and treatment. The study we will be discussing today was published in the Indian Journal of Clinical Biochemistry, and it is the evaluation of serum microRNA 24, microRNA 29A, and microRNA 5023P expression in PCOS subjects. Correlation with biochemical parameters related to PCOS and insulin resistance. So the aim of this experiment is to explain the serum levels of select microRNAs in PCOS patients and the relationship between microRNAs with hormone levels and other parameters of clinical significance. The trial recruited 40 participants, 20 control, and 20 recently diagnosed PCOS patients between 18 and 40 years of age. Women who were pregnant, had used hormone therapy, or using the contraceptive pill were excluded from the study. In regard to the sample collection, patient blood samples were collected during the follicular phase of the menstrual cycle, that is between the day the period ends and when ovulation begins. Serum was separated via centrifugation and stored at 20 degrees Celsius for later analysis. Different serum analyzers were employed depending on the component of serum. For example, follicle-stimulating hormone, luteinizing hormone, thyroid-stimulating hormone, testosterone, and prolactin were estimated using a semi-automated chemiluminescence plate analyzer. This works on the principle when there is an emission of light, electrons return from a high energy level to a lower one. Packed cell volume and hemoglobin were analysed using an automated system hematology analyzer. Anthropometric parameters were also taken, including weight, height, and BMI, along with insulin sensitivity. The collection of circulating microRNAs were extracted using a commercial microRNA serum kit. This kit essentially separates microRNAs from all other biological components, including DNA, polymerases, and proteins. Once the microRNAs were extracted, they were analysed using real-time PCR. 1 microgram of total microRNA was reverse transcribed to coding DNA using the microscript kit. Statistical analysis was carried out using SPSS data software. A standard t-test was used to test significance between control of PCOS subjects' blood parameters and levels of microRNAs. A p-value of less than 0.01 was considered significant. On the other hand, significant correlation between expression of microRNAs with metabolic parameters was a p-value less than 0.05. Receiver operating curve analysis was also performed to assess the clinical significance of the tests. Now I'll move on to Ellie, who will explain the key findings.
Now we are going to move on to discuss the results presented by Nada et al. The results have been divided into 3 sections to cover all significant findings. Firstly, the table presented on the current slide displays all the biochemical parameters and hormones levels which were analysed in patients. The p-values highlighted in purple in the table indicate parameters which were found to be significantly higher in PCOS subjects than in the controls. These include body weight, the level of glucose, insulin, luteinizing hormone, and testosterone. Only 2 parameters were found to be lower in PCOS patients than in the controls, and these are seen highlighted in blue. These are the level of follicle-stimulating hormone and the insulin sensitivity index, which is known as Quickie. The second section of findings looks at the level of 3 specific microRNAs, MicroRNA 24, MicroRNA 29A, and MicroRNA 5023P. Of these 3 microRNAs, the only significance seen between the control groups and the PCOS groups was a decrease in the expression of MicroRNA 24. This is shown both in the purple highlighted cells in the table and in this first box and whisker plot circled. You can see that the p-value for microRNA 24 is 0.00, which is less than 0.01, which was the threshold value for significance used in the study. You can also see the p-values for the other 2 microRNAs are greater than 0.01, showing no significance. Okay, now we move on to arguably the most important finding of the study, the diagnostic value of all that I've just discussed. The area under the curve is the tool which looks at both the sensitivity and the specificity of a parameter and is used to measure its accuracy as a diagnostic test. The area under the curve for microRNA 24 was found to be 0.87, which reflects a good diagnostic value. The results from microRNA 29A and microRNA 5023P showed no diagnostic value. The last section of results looks at both negative and positive correlations found between the expression of these 3 microRNAs and all the biochemical variables which I discussed in the first section of results. The significant findings to highlight here include a negative correlation between microRNA 24 and many parameters, which you can see in the table, including BMI, glucose, insulin, luteinizing hormone, and testosterone levels. There was also a significant positive association between microRNA 24 and high-density lipoprotein cholesterol, HDLC. The only other correlation found was that microRNA 29A had a significant positive association with HDLC and a negative association with luteinizing hormone. Okay, now we move into the key findings presented in the discussion. Then I'll pass over to Isabelle to continue discussing the importance of the study. As I've just detailed, it was found that microRNA 24 had a positive association with HDLC and a negative association with many studied parameters. No significant changes in the levels of the other 2 microRNAs were found in patients with PCOS and the control groups. There was no significant association between the studied parameters and these 2 microRNAs, except for the small finding that microRNA 29A is negatively associated with luteinizing hormone and positively associated with HDLC. However, this wasn't shown to be diagnostically valuable. Therefore, the most significant finding of the study was that serum levels of the microRNA 24 is lowered in PCOS subjects when compared to controls, and that this could be of diagnostic value. Now I'll pass over to Isabelle to discuss the importance of this further.
When considering these results, the most significant clinical and diagnostic value stems from the finding that microRNA 24 is lowered in PCOS patients. This is because microRNA-24 has been shown to play a role in the regulation of steroid hormone biosynthesis, as well as the homeostasis of the female sex hormone estradiol. Thus, the decrease in this microRNA has numerous impacts. Firstly, the cytochrome P450 family 11A1 is a known target for microRNA-24 and a key enzyme involved in the synthesis of steroid hormones. Therefore, decreased levels of microRNA-24 observed in PCOS patients may lead to an increased expression of CYP11A1 and enhanced synthesis of androgens. MicroRNA-24 also plays a key role in the homeostasis of estradiol, and so this decreased expression of microRNA-24 may result in dysregulated estradiol levels, which will in turn disrupt ovarian follicle development associated with PCOS. Additionally, the study suggests that microRNA-24 also plays a key role in glucose homeostasis, and thus is associated with the development of type 2 diabetes. This is because all PCOS patients studied were found to be insulin resistant and hyperglycemic, and there was an inverse association between the expression of microRNA-24 with glucose, insulin, HOMA-IR, and FIRI. These findings suggest that microRNA-24 plays a key role in the pathophysiology of PCOS, as well as the metabolic risks such as type 2 diabetes, insulin resistance, and hormonal dysregulation. When examining these findings in the context of other current literature, it becomes clear that there is an abundance of research being conducted surrounding the pathophysiology and diagnosis of PCOS via biochemical techniques. In a study conducted by Cirillo et al. 2019, they similarly investigate PCOS ovaries and the recurring dysregulation of the microRNAs which are responsible for controlling insulin sensitivity. This study analysed the microRNAs 146A, 155, 320, 370, and 486 using reverse transcription PCR and the biochemical assay technique ELISA. They similarly found that these specific microRNAs showed changes in the PCOS ovaries related to insulin sensitivity. Therefore, this study also provides evidence for new regulatory mechanisms. Additionally, the effectiveness of multi-analyte mass spectrometry steroid profiling for use in the diagnosis of PCOS is detailed in a study by Handelsman et al. 2017. They investigate this via the use of liquid chromatography, mass spectrometry, and their findings indicate that this technique only minimally improves the discrimination of women with and without PCOS when compared to the use of pre-established testosterone immunoassay techniques. Despite this finding, studies such as this provide valuable insight into the utility and limitations of biochemical techniques in the diagnosis of PCOS. In terms of limitations of the study, its small sample size of only 40 participants in total and the uniform ethnicity of these participants means that the results cannot be generalized to the entire population. Additionally, the selection and analysis of only 3 microRNAs may have limited the study, as it is found that several microRNAs are differentially expressed in PCOS. Thus, further larger-scale studies are required. Despite these limitations, this preliminary study can pave the way for future research to be conducted. Firstly, all of the PCOS patients in this study were newly diagnosed, having been diagnosed for less than 1 year at the time of the study. It is possible that in the progression of the disease, microRNAs 29A and 5023P could also be altered. Thus, the role of these microRNAs in the pathophysiology and progression of the disease should be further investigated. Additionally, findings from this study suggest that microRNA 29A might play a role in the regulation of LH synthesis, as it is identified that a negative association exists between the levels of LH and microRNA 29A. However, there was no significant difference between the serum levels of microRNA 29A in PCOS patients and the controls. Thus, further study needs to be done to investigate its potential regulatory role. In summary, among the 3 microRNAs studied, the major findings from this study are twofold. Firstly, it was found that microRNA-24 is decreased in PCOS subjects when compared to the control, and the area under the curve shows a significant difference, which is indicative of a significant diagnostic value. Additionally, the association of this microRNA-24 with metabolic variables and hormone levels suggests that it may be involved in the pathophysiological changes observed in PCOS patients.